Hey guys, it is a Mother's Day weekend edition of the Original Strength Podcast. Today I'm talking with physical therapist Julie Wiebe, and Julie specializes in returning women to fitness after injury and pregnancy. So we are talking about some women issues, but also men issues, but really we're focusing on women today. We're really diving into pelvic health and what it means to restore your pelvic health so that you can live your best life. So pull up a chair and buckle up and enjoy the show. But before you listen to the show, a word from our sponsors. Today's edition of the Original Strength Podcast is brought to you by OSIonline.com. And on OSIonline.com, you can check out the program Design Your Body. If you want to become resilient and strong and live your best life with using your own body weight, this is the program for you. I highly recommend it. You won't be disappointed. It will work you and it will glue you together, and you will feel strong and able to do anything you want to do. All right, now on to the show. Pull up a chair and buckle up. It's the Original Strength Podcast. So, Julie, thank you for being on the show.
My pleasure.
You are a physical therapist who specializes in helping women return to sport and fitness after injuries and pregnancies.
Yes.
So my first question is, as a professional, what got you started there? Well, I know because you must be passionate about that.
Yes. Yes.
So tell me your story.
It really all started with my own pregnancy, and my background is in sports medicine and orthopedics. I've always treated those populations. And when I had my first pregnancy, my daughter's now 20, I didn't really, as a physical therapist, I just assumed I'd figure out whatever I needed to fix. I'd be fine. And my own challenges just to recover. I didn't have any pelvic health needs, like what we generally think of as pelvic health, but I couldn't quite feel at home in my own body again. And so I really tried to start to understand what exactly happens after pregnancy, what happens during pregnancy, like to try to understand it a little bit better. Meanwhile, treating my patients who were troubled with the same kinds of issues I was. And it started to dawn on me that a lot of the folks that I was seeing in clinic were really postpartum women. They were postpartum females that had never really recovered from their pregnancies. Like they were experiencing very similar issues to me, but they had just been experiencing them for a lot longer. And so it sort of really set my path to try to understand better what those changes are that come with pregnancy. And then what kind of solutions do we have? And at the time, we really didn't have a lot of solutions that included fitness. And I was a sports medicine PT. I'm now a very aging athlete, but then I was a recently retired athlete about 20 years ago, I guess you could say. But it really, there was really no pathway to fitness, and that is my passion. Like, fitness is so important. We got to get folks back to doing things that can really optimize their long-term health. And the conventional wisdom at the time was, if you had any kind of pelvic health consideration, that really you should stop fitness. That was just it. It was done. And my patients refused to stop. And I didn't blame them. So I tried to find solutions to help them. So that's really, it's really 20 plus years in the making to try to find and continue to find new solutions for that population.
I noticed you had a recent, I don't know how recent it was, but on your Instagram feed, you make a distinction, or you're proposing a shift between thinking about pelvic floor health versus pelvic health.
Oh, yes.
So can you expand on that a little bit?
And it's really not a new thought, but it is a new way of maybe communicating it. And I think it's because, if you were to suggest some kind of training program for someone, you would never focus on one muscle. We don't have bicep therapists. We don't have quadricep therapists. We have folks that look at the whole body, and we integrate the bicep and the quad. And so, but we really sort of, and the pelvic floor does have specific jobs that it needs added attention and focus on. And thank goodness we have folks that understand those things deeply. But we need to appreciate that the solution for a pelvic health issue. Sorry, let me just back up for a second. So what we've communicated by saying pelvic floor all the time is we've said that the pelvic floor is the only reason that you're in trouble and it's your only solution. But the reality is, when we start to look globally, we understand that the glutes have an influence on what's going on with the pelvic floor. The abdomen does, the diaphragm, breathing. It's one of my favorite topics, and I know it's one of yours. That there are significant influences that impact the behavior and the nature of what's going on in the pelvic floor area. And so the pelvic floor isn't the only area that we can focus on when we're caring for those needs. And it's also, it also contributes to things like hips and low backs and power and lifting a weight and running. Like, it's part of all of those systems, but we've sort of isolated it away and talked about it singularly, but it doesn't really work that way. Like, the body doesn't work that way. So I'm really trying to shift just that communication. Is if we can just cover pelvic health, then we opens tons of options to start to treat it and integrate it and encourage an understanding of it throughout all areas of clinical practice and physical training and fitness. Just moves us into a new kind of understanding of those needs.
That's awesome.
I hope that was clear.
Yeah, it was. I like it. I dig where you're going. I was I was already thinking of making changes in some of our educational material just based off what you just said.
I'd love that. Because it just shifts your thought process.
Yeah.
And you can't see your pelvic floor. You can't touch it. You can't. So to understand that there are things that you can see and interact with that could influence its behavior and what's happening and your pelvic health needs, it just broadens the power structure. Like, it puts the power back in the hands of those that own pelvic floors, and that's all of us. And it also gives us a power. Yeah. And it gives us a little bit more autonomy over the situation. Like, it's not so mysterious. Like, we can actually do things that have an influence that we're really comfortable with, that's in our wheelhouse.
So I know you specialize in women, but just a neat thing that is neat to me, because it's just, I never anticipated it. But on my YouTube channel of exercises, the most searched for exercise, or I guess issue, is pelvic floor issues.
Mm-hmm.
Pelvic health. But I said pelvic floor in case people are looking at the videos. They're actually labeled pelvic, but I can change that now. But it's the number one health topic that seems to be searched for on my YouTube channel. But it's mostly men that are searching it also. So it's not just women aren't the only ones that should be or need to be concerned about pelvic health.
Absolutely. And I think that that's a shift too for us, which is awesome. And I think that it's really important that even in those populations as well, that you understand that it's not just pelvic floor, like how you're lifting a barbell, using your glutes, using your abs. It affects what's going on for male pelvic health as well. So yeah, that's awesome. So
going back to helping women after childbirth returning back to sport, I know you believe this, and I know this, like, the body is made to heal.
Mm-hmm. Yeah.
So, like, what is it that we're not told how to heal? Like, a woman's not told how to heal after childbirth, or where are we? Yeah. What? Yeah.
How do you leap? So there's so many things that need to happen in order to help folks do that. One is we need to stop just talking about pelvic floor, to sort of isolate that away. We need to also understand that pregnancy impacts the whole body. Like, I know breathing is a huge part of what you do. And the diaphragm in pregnancy, the diaphragm lifts 5 centimeters or more into the rib cage. The rib cage position shifts. Like, there's so many things that happen. I mean, and that's just talking about
because there's a baby in the way.
Correct. It's hanging out. It's taking up real estate. And that shift is necessary to get through pregnancy, and it helps you get over the finish line. I do think that there are things you can do to kind of maintain and improve. But at some point, there's just so much real estate, right? Like,
right.
There's just only so much you can do. But I think that what we focused on so much is weight loss, and getting your abs flat again. Like that's sort of, and then maybe throw in a few Kegels, which is the pelvic floor exercise, right? So that's sort of what we've identified as as pregnancy recovery. But the reality is most folks do want to have some sort of robust return to exercise. Like now we have a fitness culture out there. Like most folks want to do something, not everyone, but that is a leap. Like if that's what you think pregnancy recovery is, you know what I mean? To understand that it's both more complicated and it's more involved, I guess I should say. Like we need to understand that our whole body went through pregnancy. There's other things that were affected for 10 months of using your body in a different way. And so trying to help, one of my pushes out there is to help folks get baselines before they get pregnant. So as we approach, like, I know we're talking about Mother's Day a little bit here, is as we approach, if that's something that you see in your future, understanding your baseline function at this point is awesome. So that when you get on the other side, you're comparing you to you instead of you to the Instagram feed. You know what I'm saying? So it's like that idea that we understand, what did our lifting form look like prior? What did our running form look like prior? So I have all my clients are fitness related. They all do some sort of level of fitness, usually high level. And I want to see what they ran like before. Is what I'm looking at now what your body has shifted to postpartum, because that's how it got over the finish line of pregnancy. This is what you've been training in, or is this what you've always looked like? So then it helps me understand sort of what exactly am I seeing and what's worth changing? Like I'm trying to get you back toward your baseline, not some perfect running form, right? It's sort of a real, again, it's a shift in our thinking. And I think that's part of that resilience. Like we're building back in your like DNA, the way that you're designed to function at your optimum, which is individual. Like there's some 100%, there's some carryover and patterns and all that stuff. There has to be, but getting you back toward your baseline really will help you return to things you enjoy. Your body understands those things. So that leap is, so sorry if I went off on a little bunny trail there, but that leap is that understanding where you're starting from is really helpful from an emotional and intellectual and physical standpoint to get you on the other side back to that resilience. But we also have to start to really appreciate that our whole body changed due to the pregnancy, and not changed in a bad way, but changed in a way that we need to recognize and honor so that we can sort of pull our pieces back together. So what I usually try to recommend to folks is to do some sort of broken down version of the fitness they'd like to do. If it involves impact, we should do some work to start to prepare you for impact. If it involves high intra-abdominal pressure, we need to start to prepare you for taking on pressure again. Instead, folks go right back to doing what they used to because they figure, well, how else am I supposed to get back? I got to start running again. But I want to prepare them for running. I teach them to prepare and then participate. And so it's sort of breaking down elements of the fitness you'd like to do and then sort of building it up gradually. And that's sort of the path that I put folks on. And that integrates pelvic floor and abdomen and breathing to sort of reorganize that system through those activities, broken down and then built back up gradually into higher and higher levels of fitness. Does that make sense, or did I go off on too many?
No, I love it. I think the clever pull out of that was you prepare them to participate, to integrate.
I love it. Yes, amen. That's it. And that's really the path, because everybody's path is different. Like if I sat here and pretended like it's these 6 exercises and then you're back, that wouldn't work for everybody because not everybody wants to do the same thing. So rather, go ahead. Sorry.
No, because I love that you totally approach it from a holistic approach, but you also honor the individual that's in front of you, right? So,
yeah.
This is going to make this next question frustrating. Are there certain practices though that, because that like in common that a lot of people would have in common that would help them, I guess, keep, build, or maintain pelvic health
during pregnancy, you mean, or
just in general, or during pregnancy? Because both.
Yeah, well, one is, I think, Sorry, that is a tough question.
I know.
Yeah, I know. Well, it's not a tough question. I think it's because it's like enough for folks to start thinking beyond just the pelvic floor, right? So
Right. Yes.
yeah. So if we can make that shift and we start to understand that the pelvic floor is a part of multiple systems. So the first system it's a part of is sort of this, really it's the core. And, but when I say core, everyone listening is probably like, oh yeah, my abs, you know what I mean? And we sort of have this very, yeah. Well, and maybe not everyone anymore, which is good, but we got to understand that the pelvic floor is actually a part of that system. Like the initial effort of the core, like when we first started understanding that, the pelvic floor was a part of it. It wasn't just the TA. And we also kind of forgot that the diaphragm was part of it. And so understanding that the pelvic floor doesn't act alone, the abs don't act alone, and breathing doesn't act alone. They all intersect with one another to help us have control over our center as we move through space. Like if you can get to that piece, then if you understand that the pelvic floor is part of that system that everyone doses in fitness and clinical medicine, we all say, brace your core and now do this exercise. I don't think you do that. I know you don't do that. But that's sort of, it's just ubiquitous. Every type of condition, shoulders, elbow, whatever, we just throw core at it. But that understanding of that is the link between pelvic health and fitness. Like if you understand that the pelvic floor, if you can understand it's part of that system, then you can understand how what's going on with the pelvic floor and pelvic health of your patient might be influencing what you're seeing with their fitness, right? Does that make sense? Like that's our bridge. But also what you're doing with your fitness will impact what's happening with pelvic health. Like there's a big Venn diagram there. And so if you can get to that, if we can get to pelvic health conversations and we can get to the understanding that it's a part of that system, that deep central control system, then it makes a lot of sense why it's not that hard to leap into understanding how it's linked to fitness and performance, because we dose it all the time. We say core, 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 right? So if you can understand and create relationships between the breathing and abdominal wall and the pelvic floor, and you understand those interrelationships, then you can integrate that into movement. And I just ask my patients to choose meaningful movements, things that mean something to them. And if those meaningful movements for my patients is usually fitness. And that's what ultimately creates that carryover, because they know those patterns, their brain knows those patterns. So I just pattern in that breathing. I usually use that as my gateway in to that system, because people know how to breathe. Well, I know.
After you teach them.
What's that?
I said, after you teach them how to breathe, they know how to breathe.
But at least it's familiar, right? Like
Right.
it's familiar territory. And so they like to help them understand how, and intra-abdominal pressure, if I'm working with like someone in CrossFit, that's something they get pressure. So that's their language that I can use to sort of link those systems into what they're doing. And then the brain's like, oh, cool, I can put this in this pattern. And then we hopefully get carryover and not have to think about it all the time. Like that's the goal, right? Automaticity, making it automatic, right? So
yeah, because if you have to think your way through life of always tightening your core, that's going to be exhausting at some point, and you might forget eventually.
Yeah, but I think we all were, when we first started understanding it, that's what we all did. Guilty as charged, you know what I mean? It's all we understood, but it didn't make sense. Like if you really understand how we absorb impact, or for some reason we haven't decided that's true for the trunk. Like we keep it very stiff, but we ask people to run with a stiff center. It doesn't really fit, right? So yeah, so we have a lot of work to do. There's some undoing to go forward in new directions, but it's all part of the evolution of practice, right? So yeah,
that's great. Beyond, like, obviously pregnancy changes a whole lot of things. We talked about the real estate and everything's just different. Stuff's pushed out of place because there's a growing hungry baby making demands. Beyond pregnancy, what are some other life issues that affect pelvic floor health?
Great question. So let me just say this really quick. That system, that deep system, breath or diaphragm, tummy, pelvic floor, they're the most intimate with the baby. So they get the most disorganized, right? So that's sort of where like reorganizing that's always my first step. But we do have to appreciate for our mamas, like sleep stinks, and that's going to affect resilience and healing and emotional states. And and we also know injury risk goes up with sleep. There's a really interesting study that looked at risk factors for injuries or pain postpartum. And I have to pull it up. I'm so sorry. I can't remember all the 6 variables, but one of the variables was sleep. Like, and I think that's sort of becoming a new understanding, but I don't know how to change that for postpartum folk. And I don't know how to change it for me, for my 3 dogs. Like it's sort of the nature of the beast, unfortunately, but social structures, we're here talking about all this, all you have to do is do these, exercises and link it into your meaningful movements and all that stuff. But a lot of folks don't have the space in their life to be able to do that. Like I try to integrate it into function for folks. Like when you lift the baby, that's another meaningful movement that you can put this into. But some folks don't have social structures that support them. They have to go back to work quickly. There's just people that don't have access to any kind of care. I think social media is helping / hurting this particular patient population because there's so much information out there and it drives a lot of fear. I treat fear clinically so much now. It's really, it's hard. But I think, access to the ability to eat well, sleep, exercise, there's so many things that influence that recovery. And also, I think there's also an expectation you don't have to. It's normal. Like everybody, all these people out here have had babies. They're fine. They went back to work. Well, we could change the maternity leave. That'd be nice. We do have some bills on the legislative floor that will hopefully help, but maternity leaves would help. I don't know. And now I'm going on and on. There's so much that folks need to recover. And it's not easy.
Yeah. Like, so in general, life issues like stress itself
Sure.
can alter pelvic floor health.
Oh yeah. We actually have not a lot, but we understand that anxiety and depression, like that we see higher rates of pelvic health dysfunction. And we also understand that kinesiophobia, fear of movement, and depression and low back pain are all linked in our postpartum population. So, but we have to kind of think about where that fear of movement would come from. And some of it is this lack of central control, I think, like this sort of subconscious awareness of that. But also the world, the internet's very scary. What you might hear, it might drive your fear that you're going to injure yourself. We know that barriers to return to exercise for a lot of our postpartum folk is that they feel like they're going to not do it right. So, so again, that's where honoring movement and trying to find their baseline is a little bit gentler than doing it like this. You know what I mean? So yeah, there's a lot of pieces of that puzzle. I hope I'm sort of throwing a lot out there. I hope that that's coming clear.
It's good. Because it's a complicated issue.
Yeah.
Because of because it's in the pelvis. Like a lot of people maybe don't know how to seek help. They may be uncomfortable seeking help, or they may suffer until they're fed up or like they're probably going to go crazy before they start to seek. I mean, I'm sure you see people that have dealt with, pelvic health issues for a long time before you found them or they found you.
Yeah, I think that for one particular diagnosis, which is called endometriosis, I think we do have evidence that it takes folks usually 7 years to get help.
Wow.
Which is nuts. It's nuts. And I'm going to go back to the male issue, just for the male thing that you brought up. I was, prior to COVID, I had started a conversation with a group to do some research. And one of my jobs on the team was to find standardized cues to give the people in the study, and this was going to be all biologically female folks in the study. And it was cues to help them to standardize what we were going to say to them to activate in these particular components of the study, the pelvic floor to activate. So we looked up, and I asked all my pals, like, what do you guys, where's some standardized information? Like, I'm looking in the research, I can't find anything that standardizes it. But do you know what we do? And I've been at this for 20 years. My daughter's 20 years old. These are folks that have been in the industry for a really long time. None of us could identify a standardized way of cueing for females. But you know what does exist? So what does exist is there is a study on the best cues for males. Like, someone has looked into it. There's one study, one for males. So I hope you're picking up what I'm putting down. It's that, like, it's fascinating to me that we don't have more information to help our female population. And part of it's because it's like normal. Like, it's so normalized that we just kind of fall apart after pregnancy, and it's so normal. But for dudes, it's like, what? I'm having erectile dysfunction. Somebody better pay attention to me. Do you know? I'm sorry, I'm going a little.
No, this is great. No, it's good.
Yeah. So it's really, it's sort of, it's sort of an interesting shift that we need to make culturally to prioritize these needs, to really recognize that it's hard. It's really hard. And we have not really supported mothers and motherhood for a long time. So
for the moms out there that are maybe dealing with pelvic health issues, or any woman, doesn't have to be a mom.
Yeah.
You specialize in helping women return to sport.
Mm-hmm.
So I guess my question is, can they heal? Is there hope?
Yeah.
Can you?
Yeah. Yeah. Oh yeah. It's fun. It's fun to say to someone, like, let's try. Now, that there are injuries, just like anything, right? Like, if you are a boxer, there's at some point where you're like, you've had 20 concussions, like, it's time to hang it up, right? Like, I'm not saying I'm not equating that to this necessarily, but the reality is there are injuries that we know can be very challenging. But does that mean that they can't do some form of exercise? No. It's finding something that keeps them sub threshold, like, right, keeps them moving in a way that restores their joy and their movement, that may not look like what they want to do, but so there are those folks that's true for. And there are really challenging things that happen out there that make it very hard to get back to what you love. However, I would say a majority of folks, there's absolutely stuff we can do to help them get back to what they love and they enjoy. And I think that the message for a very long time has been very protective. And what we're really moving towards is, like, let's see what we can do. And we know that movement is restorative. We know that that we can get you moving, and that sometimes you will continue to have pelvic health symptoms as you move in those directions. But if they're not escalating, then whatever you're doing for movement isn't recreating them or making that situation worse, right? So then you're going to get those benefits of the fitness, while we keep working on the pieces of the puzzle for the pelvic health consideration, right? Like, I think that folks get really nervous, and sometimes it's just finding, how can we find success? So that's what I work a lot with my patients on, like, where can you continue to move without irritating those symptoms? And then we'll sort of keep doing those things. And then let's hold off on the things that are irritating your symptoms. And then let's try to solve that problem, right? So it's a very kind of a different way of moving into it that's like sports medicine. Like, to me, I've just applied sports medicine to pelvic health considerations. Like,
Right.
If you were an athlete and you came to me for your knee, I would be working, you'd be on the bike, right? Like, you wouldn't be running, but you'd be on the bike. I'd be working out and trying to figure out how to help you keep your endurance up for your athleticism, but we got to maybe be a little bit more specific around the knee, right? Like, so it's to me, nothing I'm saying is that different from what we've understood around sports medicine. We just haven't really applied it with pelvic health. I have been trying to, but we still have a lot to learn, and we're starting to get there with some research, which is exciting. So I hope that answered your question.
Yeah.
It's not, but I think it's either or, right? Like, I got to be able to go out and just start running. I'm going to prepare for a marathon 3 months after I deliver. I'm like,
but like, for what you do though, like, if let's say I was a runner and I had a knee injury, and you were gonna try to help me keep my fitness up by putting me on the bike so that I could still do that. You're doing more than that though. You're also helping me keep my mind up, like so that I don't
And
plummet into some weird depression or something
uh-huh.
worse. Or
Yes, absolutely. And I think that's huge because honestly, I think often what I've done clinically and what I've done out there with my own efforts in social media and education and all that kind of stuff is really just to be able to say yes. Like find what you can say yes to. Find your we just got to stop just saying no. You know what I mean? No, you want to do CrossFit? No, you can't do that. You're pregnant or you've had a baby. But would I say to a CrossFitter, hey, we might need to adapt some things here. Like, let's maybe consider how we're going to scale that. And as you get larger and larger, you might need to do more adaptions. That's a very different conversation with my athlete, right? And that is also then an athlete who's like, I'm feeling heard. This is someone who understands what I'm doing and I'm trying to do, but my goal is so they can do CrossFit forever, not just to manage their whatever, that sense that they're losing themselves if they don't continue. Like, I'm going to help them continue in a way that's also going to continue forever, hopefully, if we manage as many variables as we can. But there's unknowns that we can't manage, and that's the tricky part with pregnancy and delivery. There's just stuff we can't predict. But we can optimize, right? Like, we can do the best that we can to control variables, but that's just a really different conversation that keeps the power with them, gives them some autonomy, and gives them continued autonomy is what I should say. And then it speaks to their heart and their brain. Yeah.
yes, yeah, and that keeps hope alive, and
Hope.
I mean, that's powerful.
Oh, it's so powerful. And listening, I think you probably know this too. Like, it's such powerful medicine just to feel heard, and
Amen.
understood. Yeah. So, yeah. So it's a lot. There's a lot of that needs to happen with this population. And it's like formulaic, here's 6 exercises and just lose weight. Like, all these things we've talked about, like, I've tried to keep it, relevant and attainable, but like, the idea that all we've ever focused on is weight loss, getting your tummy flat, and Kegels. Like, when we talk about all this stuff that's impacting people's recovery and all that stuff, like, mamas, females, males, we deserve better. Like, that's it. We just deserve better to be able to, we deserve better, and it's coming. We're working on it. There's a lot of us behind the scenes working hard to try to bring new conversations, new shifts, new ideas, so that the next generation, they step into postpartum with a very different world around them. Like, I'm going to change the environment
Yes.
for my own kid when she finally, if she chooses it and she becomes a mom, when she steps into that, she's going to be surrounded, like, the environment will encourage recovery versus what I experienced when I had her. That's been my mission.
I don't think there's any greater way to kind of close this conversation right before Mother's Day than
There
to
you go.
say, mamas, you deserve better.
Yeah.
That's pretty powerful.
Yeah.
So,
Agreed.
so Julie, if someone wants to learn from you, or they want to heal themselves, or they want to find you or find someone like you, where do you have somewhere they can go?
Yes, I am on all the socials, Julie Wiebe PT, and you can even misspell my name and usually find me. Or mispronounce it. And you haven't, but and then I also have a website. It's juliewiebe.pt.com. There's lots of resources on there. And one of the resources on my website, I do have a lot of information for individuals, but I also have a Find a Pro map. So there are folks that have taken my educational programming on how to work with athletic populations and all pregnant and postpartum populations to kind of move in this direction. There are folks that have done that are on my site. So you can find them in your local areas, and that's worldwide. I don't know. But we are working hard to get an army of people out there that can handle these needs, and it needs to move beyond. Part of why I want to stop talking about the pelvic floor only is because I think trainers, orthos, sports medicine people, like, to really understand the whole person standing in front of you, you have to understand this part of their history. Like this is, I call it a hidden history. It's like, oh, you've had 3 pregnancies. Okay, great. So tell me about your hip. You know what I mean? Like, it's like this, they just forget about it, but it's like, wow. So those folks exist, and you can also find them at the Academy of Pelvic Health, which is an American Physical Therapy Association. They have a website, the Canadian, UK, all of the major physical therapy entities that oversee national programming have pelvic health academies or schools that can also guide you towards folks in your area. So there's a lot
Awesome. And I will not misspell your name in the notes of the show in case people are looking and they just want to click. We'll make it
That
possible.
sounds great. Thank you. I appreciate it.
One last question.
Yeah.
Maybe 2. Do you like peanut butter?
I'm allergic.
Oh, wow. I'm so sorry.
No, that's okay. I don't know where this is headed.
Well, I ask everybody. I knew one day I was gonna get somebody that couldn't eat peanut butter. So are you allergic to just peanut butter, or are you allergic to all nut butters?
I use sunflower seed butter.
Which tastes amazing.
I know, right? I'm lucky. So I do. Yeah, that's my alternative. So
okay.
Yeah.
So then the next follow-up question with that would be creamy or crunchy
Oh,
sunflower?
creamy. Come on. Ugh. Like,
Okay. Okay. That was a
I have
very strong.
a huge aversion to that crunchy stuff.
That was a very strong,
But I
strong
don't think
preference.
is there a crunchy version of
They do.
sunflower?
Oh,
Is
yes.
there?
Yeah.
Oh,
There's multiple different brands of sunflower seed. Like
Okay.
I'm just a nut butter. I love all nut butter. So yeah.
Well, listen, I've like blocked it out. That's how strongly I am averse to the crunchy.
All right. So when you eat the sunflower seed butter, how do you enjoy it? Like, what do you put it on? Do you just eat it out of the jar?
I do actually eat it out of the jar. Bananas. That's a snack.
Winner. That's
Yeah,
it.
is that good? Did I win? What do I win?
Yes, because that's the best way. Yeah, eternal friendship.
Perfect.
The best way to
Done.
eat any nut butter is to take a spoonful of it, put it on the end of a banana, and just eat. Like I can
That's
eat a half a jar of nut butter with one banana because I'm just putting it on there the whole time.
I know, like a lot.
Yes.
Yeah.
Yeah.
Oh,
Yeah,
wow.
yeah.
And I'm your first allergic. Oh, wow.
Yeah.
I feel honored.
So congratulations on that too.
Thank you. It's a big day.
It is. But so this has been awesome. Thank you so much for
I
sharing
appreciate
your knowledge and your time with us.
Well, thank you
this
so
is
much for
great.
having me. I really appreciate it.
Thanks for listening, everyone. Now get outside and play.